Hello everyone, my name is Sharzad Green and I'm a pharmacist. I specialize in natural or bioidentical hormone replacement therapy. Today's topic of discussion is about adrenal fatigue syndrome. Adrenal fatigue syndrome is a term that we use to describe a person whose adrenal glands have been fatigued and tired. Now that could be due to either acute stress or it could be due to chronic stress. But either way, when the person comes to me, oftentimes they complain of difficulty sleeping through the night, extreme fatigue during the day, even when they wake up after they've slept through the night with the aid of sleeping pills. And oftentimes they complain of weight gain, especially in the midsection. So where are your adrenal glands? Adrenal glands are on top of your kidneys and they help you get through stressful situations. So for example, if your dog is sick, you stay up 3 nights in a row, take care of the dog, and still go to work during the day. That is your adrenal glands getting you through that stressful situation. But then if the dog remains sick for longer than 3 days, or the cat gets sick and the dog gets better or remains sick, basically you're dealing with either additional stress or a different kind of stress. And in those cases, your adrenal glands have to work even harder to get you through everyday's life. The adrenal glands produce a lot of different hormones, but one of them that's a key hormone is called cortisol. And after a while that they keep producing a lot of cortisol for you to get you through all that stress, then they get exhausted and they don't produce cortisol in the way that they're supposed to. So what happens is your cortisol starts bouncing around throughout the day. So you may wake up with a low level of cortisol. So oftentimes what happens is people resort to things that stimulate them to be able to work. For example, they resort to coffee or a diet soda or even a regular soda because of the sugar and the caffeine. And that gives them a temporary boost, maybe for an hour or two, and then later on they crash. When they crash, they repeat that pattern again. Oftentimes, a stressful situation comes their way, so they have to deal with that, and that alone raises their cortisol level. So this going up and down of cortisol throughout the day is teaching your adrenal gland that's the way they're supposed to behave. Therefore, at night, when the person goes to sleep, the adrenal glands may continue acting the same way. And as the cortisol goes up during the night, the person finds themselves waking up for no reason and having a difficult time falling back asleep. This may happen several times in a given night. So in the morning, when they wake up, they don't have enough cortisol because the adrenal glands have worked all night long producing just small spurts of cortisol. So they cannot actually produce the amount of cortisol that's needed for morning. And these people oftentimes find themselves very tired in the morning. And therefore, this vicious circle continues to happen. And in those cases, the patient gets worse and worse and worse. Now, the medical community has not really acknowledged adrenal fatigue syndrome as a true medical condition. This is something that we see in patients all the time. However, there is no definite medical diagnosis. The medical community does not recognize adrenal fatigue syndrome as a definite diagnosis. We see it all the time in our patients. And the way we decide whether a patient has adrenal fatigue syndrome or not involves checking their cortisol level 4 times in a given day. So the patient actually takes a sample of the saliva in the morning when they wake up. About noonish, later on in the afternoon, and then at bedtime before they go to sleep. And that gives us an indication of what a person's cortisol level is throughout the day. By doing so, if we find that the cortisol is following the wrong pattern, then we can actually try and treat the patient. Now, the first treatment, and I always say this to my patients, the first treatment for adrenal fatigue syndrome is actually removal of the stress. So if it is something that you're able to reduce the stress or remove the stress, that is really the best way to treat adrenal fatigue syndrome. The second thing that I always recommend is de-stressing activities, because you want to give your adrenal glands a break. You want them to be able to recuperate and regenerate on their own. So de-stressing activities such as deep breathing, yoga, meditation, those are all wonderful ways to help your adrenal fatigue syndrome. The third thing that I always recommend is reducing the stimulants and things that help raise the cortisol level, such as caffeine and sugar. So we want to be really mindful of what goes into our bodies. Even smoking, alcohol, those things are very harmful for our adrenal glands. And the fourth thing is taking supplements. Now, taking supplements can be very tricky. There are so many different supplements out there in the market. And if you're not careful, you could actually take a supplement that would backfire and make things worse for you. It's very important, before anybody puts you on a supplement for adrenals, to do check your DHEA sulfate level. DHEA sulfate is a hormone that is produced by your adrenal glands. And oftentimes, the supplements that are over the counter may contain DHEA because that is supposed to give you energy. But if you're at a situation with your adrenal glands where they're overworking and they're actually overproducing DHEA or DHEA sulfate, then that actually backfires and may make things worse. There are also some herbs that goes into these adrenal support formulas that may not be the best options for you. So it's very important to actually talk to an expert about adrenal fatigue and the treatment for it. I would highly discourage people from just going to the shelf and picking up something that may or may not be helpful for them. If you have any questions, do feel free to contact me. We can definitely do a saliva test and determine what to do next. Feel free to contact me at azhormonehelpers@hotmail.com to discuss adrenal fatigue syndrome, saliva testing, and the treatments. And until next time, have a wonderful and healthy day.